So with that, I'd like to wish us a very warm welcome again to this important webinar, which has been carefully put together by the Wura is Good Charity Foundation. So in the course of this meeting, we have the opportunity of getting to have better understanding of the scope of what the organization is up to, at the same time, the motivation behind doing what they currently do and what they still hope to do. The subject of immunization is something that we all consider very germane and critical. Very timely, I must say, for a time like this, especially with what we experienced during COVID-19, which was very recent, and even in more recent incidences with other vaccines that were introduced, we could all see the challenges relating to the acceptance of these vaccines and effects of infodemics and how you manage such, especially within the public health space. On a lighter note, there are possibly people on this call, participants, who were among those who believed during COVID that actually, if you take vaccine, it may lead to impotency, it could affect your fertility. Some also joined the group that believe that that site of injection, of inoculation, can actually conduct electricity or magnetize or having kind of magnetic effects on substances around. So a lot of myths and fictions out there. And so you can agree with us that immunization, for what it is, being a very critical intervention of this millennium ever since it's been introduced, is one intervention that we must guard jealously and ensure that the efforts put into it is not bastardized, is not jeopardized. Today, we have the opportunity and the privilege of having brilliant scholars, I must admit, who have been carefully selected to join us in this engagement. A renowned scholar himself, distinguished colleague in public health space, who is an authority himself, who will be doing justice to this conversation today. And that's speaking of no other person than Dr. Ileomi. And also speaking to this conversation today, we will be having the privilege of listening to Mr. Sunday Hoko, head policy strategist. And not until we've been formally welcomed and received in audience and walked us through the scope and purpose of this meeting, it's my honor and privilege to receive Wura is Good Charity Foundation CEO.
Thank you very much, Dr. Abiodun. Thank you so much. And distinguished guests, esteemed speakers, and valued participants, on behalf of the Wura is Good Charity Foundation, it is my pleasure to welcome you to today's webinar, Immunization Truths, Separating Facts from Fiction. We are honored to host this critical conversation, which aligns with our mission to promote access to accurate health information and empower communities. In today's digital age, misinformation can spread rapidly, making it essential to rely on evidence-based knowledge, particularly when it comes to life-saving interventions like immunization. Our esteemed speakers, Dr. Olayinka Elesomi and Mr. Sunday Oko, will share their expertise and insights to help us navigate the complexities of immunization and combat health misinformation. I would like to extend my gratitude to our speakers for their invaluable contributions, our volunteers and partners for their tireless efforts, and to each of you for participating in this important discussion. Your engagement and commitment to learning are crucial in promoting informed decision-making and dispelling harmful myths. Throughout this webinar, we encourage you to actively participate, ask questions, and share your thoughts. By working together, we can empower ourselves with knowledge and strive towards a healthy future for all. Thank you all, and let us begin this important conversation.
Without further ado, in the interest of time, start with for us today. It's my pleasure to lead us in the conversation on immunization advocacy. How do we ensure we're able to counter misinformation and reaching the underserved population? I have the honor and privilege of a public scholar of no small means. Dr. Olayinka Elesomi has an MSc in PED and medical statistics. He holds a master's in science in global health policy and management. He's a man of many degrees and certifications, MBA, MH. He's a doctor also with a PhD in public health, a medical doctor, a fellow of West Africa College of Physicians, specializing in community health. He's bringing to the conversation over 18 years of experience as a public health specialist, an expert in health system strengthening, primary health care, disease prevention, capacity building, and outbreak response. He has a lot of contribution academic-wise in adjunct professor of public health. He supervised 10 PhD and MPA candidate. And my interest is to know is one of the highest published writer in the country when it comes to publications around manuscript. He has about 305, if not more than that. And when it comes to citation of the work, even in Google Scholar, he has over 125,000 of such. He's among the highest cited researchers in Nigerian public health in Nigeria and has been consistently ranked top 2% researchers globally. More than 60 conferences are attended globally, recipient of numerous international and national awards. Ladies and gentlemen, Dr. Olika Ilesami is a postdoctoral associate, Yale School of Medicine, 2019. He's a clinical epidemiologist with the College of Medicine, University of Ibadan. He's a lecturer in community medicine. And current role speaks to his position as West Africa Regional Program Lead for Africa CDC, an adjunct professor of public health, Lead City University, Ibadan, or your state, just to mention and say, but a few. Ladies and gentlemen, please receive with me to break the ice on the conversation, Dr. Olayinka Ilesami. We call him professor. Of course, if somebody has this list of publications, I don't know what he's waiting for to become a professor anyway. So, Prof, the floor is yours.
Okay, thank you very much. I would like to appreciate the CEO of Wura is Good Foundation and other colleagues who have made today's conversation possible. I believe that this is one of the things that is actually passionate to me. Immunization is a means of ensuring continuity. In time past, people get back to probably 7, 8, 9, 10, and at the end of the day, they have 2 or 3 adults out of 10. So many of them died due to vaccine preventable diseases. So, but we should thank goodness and thank God for the generation of the time that we are around, that we have vaccines that is there to protect not just the children, also adults, to protect us all and ensure our continuity. So today we are talking about vaccination, and we are looking at the myths, the facts, and trying to separate the two. Just like I said in the brief introduction, that vaccination is very important and the importance cannot be overemphasized. But despite the importance of vaccination, it has faced a lot of problems. It has had some like a form of attack over the years. I believe that many of us read about the smallpox vaccine. That was more or less like the beginning of breaking the ice or barrier concerning immunization. So the smallpox vaccine by Edward Jenner was able to prevent deaths of so many thousands and led to the eradication of the disease. But despite all this importance and the usefulness, it's a common thing that is well known that a lot of people have mistrust in vaccination. Many don't want to even give their children. And it's not only limited to people that are not learned or the so-called those who don't have formal education. I've had people in the past who are even learned who said no, they will never take one vaccine or the other because of one thing they've had one time or the other. And what are some of these pressing things that are causing disturbances or blocking people from getting their children immunized? People have mistrust in the system generally. And this is not only limited to vaccine. People are skeptical when it comes to introducing new thing that is new to them. They want to believe a negative reports than something that is positive. And just like the environment that we are, anytime you mention something negative, if they mention that a politician did something wrong, it's likely to spread faster than when someone has probably commissioned a particular project. Even the skeptics will say, oh, what's he commissioned? Is it not just a small project that he has done out of hundreds of millions that has been given unto him? So what am I trying to say? Negative information, they spread faster than something that is positive. Now, apart from this, there are several people who are also channeling misinformation, and they get a lot of people to support them. And we also have cultural backgrounds and some beliefs that have a way of hindering promoting false information. So now, like, people have a lot of misconceptions about anything that has to do with health, generally speaking. And when people need information about health, they don't usually go to those who know. They want to ask the person that is next to them, who probably doesn't even know better than they do. So by the time they've asked and whatever they are being told, they see those things as superior compared to what the health experts are sharing, because there is lack of trust in the system. So these are some of the things that have affected immunization practices and also the good things about it. Also, people, just because maybe one person took vaccine and developed some side effects, which is normal, which we are going to talk about also. Because of that, people may say that they may not want to get their children immunized anymore. Whereas having side effect of things, they are normal. If one takes too much water, the person may need to micturate or urinate more frequently. We can say that is more like a side effect. If one eats excessively, the person may need to pass on maybe diarrhea or watery feces, which is also known as so on. But people, once they have anything negative, they want to speak more to that, they want to promote that, and they want to use that even to prevent others from understanding the differences between what the truth is and also misinformation and also hesitancy news and information that spread very, very fast. So I'm going to hold it up for now, then I will allow the moderator to also come in at this junction. Thank you.
Thank you very much, Dr. Lai. So this question is trying to look at if those who are highly educated and they refuse to get their children vaccinated, to be convince them, what are the scientifically known risks or side effects of vaccines? I can see that you try to start with. But at least lay fears, okay, what are those known risks or side effects to expect? And there are any serious dangers associated with vaccination. I know some call it immunization. What you actually is vaccination. It is when the whole process gets done within the system and you provide the immune response, the body gets immunized. So are there any serious danger listener want to know? Are there known risks? Are there side effects of vaccines? If you would want to take that alongside the other question, that to understand some clarity around how long vaccines are still researched. If you recall during COVID, people said, oh, we come out so fast. We need that vaccine meant to take so long. COVID come out so early. Some question mark among those who feel it must have through the necessary rigorous processes expected of vaccines. So if you could help us tidy that up with around how long does it typically take for the research, testing, validation of vaccines for human use, and for COVID in particular, this participant wants to know, the COVID-19 vaccine actually follows standard vaccine development and approval protocols. If you could put the two together, Prof, over to you.
Okay, thank you so much. Now, when it comes to vaccination, just like I mentioned earlier on, like any other drug or any other food or items coming into the body, they all have their side effects. But most of the vaccines, they are given through injection, through the intramuscular routes, like using the syringe to inject the muscles. So when something is coming in through injection, there is a likelihood of having some redness, maybe some pain at the site of infection. It's possible to have some swelling. So when these are there and they are not really much, and as a result of this, there could be a reaction like a form of fever. So most times, all these are manageable. But occasionally, some children may react by having a form of, let's call it anaphylactic reaction. Like this, the vaccine is responding and affecting their immune system. So when this happens, it is a major adverse event following immunization. And these so-called events, they are anticipated. They are not things that are not expected. So that's why after immunizing a child or after vaccination, most times the baby is not usually allowed to leave the hospital immediately. You are meant to be there for a few minutes so that if there are effects or events that follows the immunization immediately, such events can be managed. But on some rare cases, as I said, we have people coming with some form of reaction like rashes, like form of going into distress. It happens to that extent. But all these are things that are also known. During the process of vaccine production, the last stage of the production, which is more like post-market surveillance, that's the stage at which these vaccines are allowed to be used. And when they are used, it means they are still going to be monitored. It's not as if there is no other monitoring going on, everything is fine. Even the so-called common medicines that we used, they still monitor them, follow them up for years, even after completing the production, after getting them certified. So some of these things are also common with vaccination, with vaccines. And it is good for us to understand as parents, as relatives of those who are getting immunized, as healthcare workers, and so on. We need to understand all this. We need to know that, oh, it is true that it is possible for children. Now, some rare side effects are also there, like maybe autism, especially during the COVID-19 vaccine. You know, it's gained a lot of attraction. People were shouting that, oh, because of one experiment, one research work that was read or that was published by someone that said, oh, COVID vaccine can cause autism. Now, what I would like to say about that was the fact that when you find out something and you want to research, you want to check for something, and it is only one person that is always saying the same thing, by the time you look at all the people that have referenced it, they all referenced the same person. All the people that have mentioned it in different publications, they all mentioned that same person. So when this is happening, you need to be very careful. But by the time researchers are researching and they are doing a lot of work, and they notice that, oh, this same person found what Mr. X found in the past. Oh, Mr. Y found the same thing. Then they can put together research work and say, oh, this is the likelihood of what we are seeing. But by the time you search the literature and it's only one same person, everybody referencing and re-referencing, citing over and over. So I would like to summarize that by telling us that vaccines are very useful. They are very, very important. They have prevented a lot of deaths, a lot of unwanted circumstances. However, it doesn't mean they do not have their side effects. But because of the side effects, that's why monitoring is being done, follow-up is being done, adverse events following immunization is also being monitored over and over every now and then. So that should not make us to decide to say that, oh, maybe there is no vaccination that works. It works. However, there is a need to be careful. There is a need to also continue to monitor and to report when it is used and we notice anything. It's up to the data that is available. Oh, I used immunization, I was immunized rather, or I took vaccine. And at the end of the day, I developed some symptoms. Now, you need to report those symptoms back to the health care center or to the health facility where you were immunized. So that will also help the healthcare workers to be able to understand the vaccines better. So now the second part of the question, talking about how long does it take to produce vaccines? Now, it takes almost about 10 to 15 years from the time that the production starts till the end before they allow people to take the vaccine, before it is approved. It takes 10 to 15 years. And these 10 to 15 years can be broken into maybe other smaller components of time. Like the first 1 to 2 years is usually preclinical. And at this point, the vaccine is not laboratory animals, just as a result of the use of the vaccine. Now, the phase 1 clinical trial starts, which also lasts some years. And at this point, it is usually started with people that are healthy. If they are tested for some years, maybe about minimum of 20 to about 100 or thereabouts. Now, once they have tested this drug or this vaccine in them, and they notice that, oh, this dosage is safe, people that are healthy have tried it. They were able to initiate immune response. Then they can start the phase 2, which are people who are also using it because the people that are manufacturing the vaccine, they want to know the safety dose, the dose that is allowable, that people can use. And apart from this, the phase 3 continues and it lasts several years as well, whereby tens of thousands of volunteers, they are allowed to use it. And once they use it, the side effects are monitored. And apart from this, diverse populations are also used. It's not just in one single group of people. They use diverse population, children, adults, and so on to be able to ascertain this. And after this process, to wrap this up, there is also regulatory review. Oh, the drug has been certified to be okay. Then the regulators like the FDA, the World Health Organization, and so on, they look at the vaccine. Is this thing safe enough for use? And so on. And after the safety has been ascertained, there is ongoing monitoring, which takes several years also. So it doesn't end by the people that are manufacturing it. It goes to the market. There is post-marketing surveillance and so on. Even when the vaccines have started, when they have initiated it or they have started using the vaccine. So these are some of the processes. Now, when it comes to some public health events like the COVID-19, that was leading to deaths of so many people, hundreds to thousands within a few years or few weeks and months. Now, some of these processes, some of them can actually be reduced. However, the stage at which the drugs is being, or the vaccine, the stage at which is being tested, that one cannot be shortened. The regulatory agencies, they still need to take a look. They need to look at it and certify it safe. And once they certify it safe, then it is. And people start using it. And after this, the monitoring, the supervision, post-market surveillance, and so on, it continues. So thank you.
Thank you very much, Dr. Laika. So the question presented, all right, and the question is saying, how should healthcare professionals in particular manage vaccine hesitancy, especially during the introduction of new vaccine like we had some years ago? And also, what steps are currently being taken to ensure equitable immunization coverage across different populations, and idea had even among the vulnerable populations?
Okay.
Over to you, sir.
Yeah, thank you once again. Now, I think as healthcare workers, part of what we need to do and part of what is being done at the moment is to ensure that the right stakeholders, the right influencers are part of the decision making at the points of introducing the vaccines, like the people, like our religious leaders, people that we hold at high esteem, that we trust whatever they tell us. Apart from that, we have traditional rulers who are also there, who are taking decisions for the people. And apart from this, heads of the family, not just the women alone. These are people that are very important stakeholders and influencers when it comes to immunization uptake. So what is needed to be done is that even at the point of manufacturing, we need to bring in all these stakeholders so that they know that, oh, there is something that is being worked on. Unlike like the time of COVID-19, many people had the feeling that, oh, the time was too short. Not knowing the fact that had some kind of diseases like MERS that was, or even like COVID-19. COVID-19 is not for our traditional rulers, religious leaders, and rely on in the society. So it's good they are brought together or they are involved, even not only at the time of the introduction. So doing this is going to be of help. And now when it comes to ensuring that vaccine gets to the people that are highly vulnerable. Now, to every vulnerable person, that is someone that is resilient or someone that is strong. Now, there is someone that is trusted. So, and every vulnerable person has someone that is trusted, someone that they can listen to, someone that can give them instruction and they will take heed to it. So there is a need to identify such stakeholders. And once they're identified, they should be part of the people that will take decision. How do we want this thing to be? How do we want these vaccines to go around these people? Now, there may be in some places we've had to vaccinate in the evening. In some places we've had to do vaccination in churches, in religious places like mosques and so on. These decisions are not just taken, but there are decisions that are taken with the relevant stakeholders. So involving the relevant stakeholders, I believe it's a lot. It goes a lot of ways in ensuring that we are able to have good success with ensuring that people are vaccinated. So like the other question that I said, someone asked, I saw it on the chat box. The person was asking that during COVID-19, why was it that we did not, the World Health Organization and other healthcare bodies, they did not allow enough time before pushing the vaccines to the people. As I was saying earlier on, before the vaccine was introduced, there are other vaccines that were going on, like vaccines against Middle East respiratory syncytial virus and so on. SARS, we had SARS in 2003. So all these, they had scientists who are already working, who are already doing a lot of things. So there are a lot of global collaboration on ground already. And because of this pandemic magnitude, there was a form of global collaboration that came up almost immediately. So because of all this overlapping trial, it's not as if COVID vaccine was started from the scratch, from stage zero. No, a lot of things are going on already. And in addition to this, regulatory agencies like the FDA, like the World Health Organization, what they were doing was that as the work was going on, they kept on approved. They kept on assessing the vaccines. As the vaccine trials were going on, at every stage, they keep on looking at it and assessing and evaluating, not waiting until every process is completed. So that was part of what helped us with COVID-19. And I think we should see that as a plus, not as something of a negative effect or something negative, but to people that spread misinformation, they say, oh no, it was not properly done. I don't want us to go home with such impression. It was thoroughly done, it was helpful, but a lot of processes, because they were already ongoing for other vaccines or other viruses, so they were really helpful. So thank you once again, moderator, back to you.
Thank you, Prof, for providing those insightful contribution. But it's important for us to know that we have in the conversation this a health policy strategist. This is someone who's experienced in monitoring and evaluation, distinguished for his proficiency when it comes to the issue of data interpretation and articulate presentations. And this is a component that's very important for us to evaluate how well we are faring with our interventions, so as to know where are the gaps and how we can really address them. Throughout his career, which spans various sectors of non-profit management, he has demonstrated or continues to demonstrate a key interest in research, social behavioral change communication, and climate action. He is very in-depth and very conversant and the subject matter expert when it comes to the issue of research, social behavioral change communication, mentoring, cross-functional leadership, change management, negotiations, and a whole lot of it, even including infodemic management, and with the right mix of relevant administrative and operational experience it brings to the table. His money holds Master of Public Health degree, his Master at Discussing Public Health Conversation, and he's specializing also in health policy and management from the University of Ibadan, the first and truly the best. Ladies and gentlemen, it's my pleasure to now receive Mr. Sunday to wade in for his own perspective in this conversation, and he will also be taking a number of questions. Mr. Sunday, the floor is yours, please.
Thank you so much for the kind introduction. I'm truly honored to be part of this important conversation today. When it comes to vaccine misinformation, it's a really interesting area and something that we all should be involved, because like Dr. Olayinka has mentioned, vaccines sort of remain our greatest hope in terms of if we want to defeat even future pandemics, right? And a lot has been said already, so I wouldn't want to go to and fro again. But I would like to define a couple of terms. And when it comes to misinformation, I would like to lay some ground definitions. And this has to do with misinformation and disinformation. So misinformation has to do with misleading information that comes without the intention to cause harm, right? And this information can be circulated across social media. You can have people, I don't know how many of us have come across those sent to 10 people and receive 10 million in 10 minutes, all of those kind of um, misinformation that is spread around. And some of them are done without the intention to cause harm. While there is actually a thin line between misinformation and disinformation. And when it comes to disinformation, especially as regards to vaccines, these are information that are termed as propaganda, really cause harm. And some of them are done by happening over the years. Misinformation is not a new thing, it's not a new field. Although during the COVID-19 pandemic, WHO also brought up the issue of what an infodemic is. They declared COVID-19 as not just a pandemic, but an infodemic, meaning that there was a lot of information out there, a lot of right information, a lot of wrong information out there. And people had this confusion of what was correct, what was right. And it was a whole lot. Everybody at that point became a medical doctor, right? Everybody putting tweets on X, on social media, putting definitions to things. Why are they coming up with the vaccines? Why? A lot of questions, really. And this led to an overflooding of the ecosystem, of the information ecosystem. That's why WHO thought it to declare it as not just a pandemic, but also an infodemic. So misinformation for the longest time has always been there. But how do we manage it? Is now what we are bringing forward. And I would like to bring up the idea of enough of pushing out the debunks. Of course, it's correct to first of all talk of how people of telling people that, oh, what you said is not right. But I want us to also think about how we can empower people, how we can make people have the capacity, have the tools, have clarity to, first of all, make decisions on their own, because that's the core of public health, of course, without cohesion, right? So I would like us to also think around how we can build capacity of individuals to see things from the point where to understand them basically, and also, like Dr. Olainka said, in terms of some of these advocacy is what the foundation, Wura's Foundation, is currently doing, making people understand how vaccines are even made to them, so that they can better make informed decisions. So really, misinformation is something very important. I would like to also bring another fact here. According to a World Bank risk perception assessment that was done last year, misinformation was ranked as number 2, right? What that means is it even ranked above things like global warming, above things like war. So it was really important for us to really talk about the dangers of misinformation. So I'll just stop here. I know the questions are a lot, so I'll just give room for more questions. Thank you, and
Okay.
over.
Thank you very much, Mr. Sunday. It might interest us to know a bit also, as he tries to explain to us, the difference between misinformation and disinformation. Misinformation speaks to the fact that you unintentionally spread a message. You don't have the intention of causing harm with it. You just out of I don't want to use the word gullible because we say people are easy to deceive, or out of the fear that has been created by the originator of the message, you just unconscious, like share the message to those you feel you need to have it. And you see such messages when they are crafted, carefully say, share it now with along with your family members and all of that. And you can see the result of that because of the traction on their site. Whereas disinformation is that individual who originated such a message or such an information with the sole intent of causing harm. So when somebody picks a genuine information about vaccination and turns it around, created a video, a lot, especially now with the days of AI, that they can make me to say what saying and put my picture there, everything. I remember a lot, some even put CNN at the background of somebody speaking. In Nigeria, they can use channel TV, trusted sources, developed with AI, share the information to confuse the innocent citizens and people of the country. So when you see such intent being played and you see such message, and you are the one holding it, what you're spreading is information, and the originator is the one bringing this information. So back to you, Mr. Oku. How can we best use social media to spread facts about vaccine? Because when people don't have the facts ahead of the emergency, then they easily get to them is what they will make do with vacuum in nature. So what are your own thoughts how we can use social media or other platform to create more awareness without inadvertently amplifying misinformation? Because there is a way you can be trying to share the right information and you're also indirectly amplifying the misinformation. So the question is, how best can we use social media to address this? And what other ways can, or in your own opinion, besides correcting the myths around this issue, what is the single most important message you will convey when promoting immunization awareness? Over to you, please.
All right, thank you so much. I'll start with your first question that talked about using social media. Yeah, so social media offers us is twofold, right? So you can use it for ill and you can use it for good, obviously. And right, so we would like to use it for good. And how do we use that? And to speak to that, we will have to be strategic and maybe I would say proactive and positive in our communication. I have a couple of guidelines that I would normally emphasize, maybe like about 5. The first is to lead with facts and not myths. So instead of repeating falsehood online, right? Why not put out evidence-based truth, right? Communicate based on evidence. Part of what Dr. Olainka does, you can just look out for his work, and those scholarly works can actually be put out there. At the organization where I work currently, Nigeria Health Watch, part of what we do is to use evidence to address some of these myths, right? So when people ask questions, misconceptions online, so rather than just explaining it, why not put a peer-reviewed journal that says everything, or that they can go and read and even get more information. The second point is to use trusted messengers, right? Dr. Olainka already mentioned something around influencers, right? And there are people who community members, people trust, right? And if they actually put any message online, if they share any message online, right, they are going to be considered as trusted messengers, right? So, and also we can leverage social media by creating engaging content, right? Using multiple methods to disseminate information like visuals, If you go to NCDC's website, for instance, they have a couple of infographics discussing about some of these misinformation myths that we have talked about. If you come to also Nigerian Health Watch, we have all of those graphics. So basically, using multiple methods online, social media allows you to do multiple formats in terms of you can do a video, you can do the current Gen Zs that I like to be called, right? They are not people that want to, sorry to say, are not people that want to read, right? They might prefer just watching a short video. So you can engage them through a short video that says things in 2 minutes, right? And we also need to monitor smartly. There's something now called social listening, and it's the idea where you monitor conversations online, right, from social media and try to make sense out of them and then bring out insights that can help your communication strategy, your overall communication approach. So we can use that as well. And the last one is to use hashtags. Hashtags in terms of social media are things that amplify your conversation. So there's a way social media, it works with AI algorithms, right? So the more you use some hashtags like vaccination, hashtag health fact check, all of those hashtags can be used to amplify a certain message. So when you're putting out messages around dispelling myths and misconceptions, you can also leverage hashtags. So I would say the single awareness, of course, is vaccines actually save lives and protect communities. Why myth busting is very critical, emphasizing the proactive, protective benefits of immunization, like we are doing today, helps to frame vaccines, not just as a personal health choice, but of course as a social responsibility. So I'm always referring, I have a bias because I currently work in an organization. So what we do at Nigerian Health Watch, we found out that when people understand how vaccines contribute to safer days in school, like missed days in work and resilient communities, they are more at ease to taking them. Because, for instance, that market woman that would have been at her market store selling, uh, if that her child had taken vaccine, she wouldn't have gone to the hospital to kind of treat and a vaccine preventable disease, right? So there are economic benefits to all of this. So this positive framing builds trust and also promotes uptake beyond fear-based messaging. Thank you, Anuba.
You were able to highlight in clear terms what we need to do to ensure that we don't keep spreading misinformation. And I dare say that these are put out there even before we have an emergency, meaning we don't need to wait for public health crisis to occur before you start thinking it is not like that. The things that you do before during the peace times matter a lot in helping the people to take informed choices. And that's about building their community resilience, push out information, let know ahead of time, create those channels that will help them build trust, and you become trusted in fact checking. So one of the things you say is before you click the share button, fact check with somebody else. Try to find out, is this really correct? And we all know all the places you could check this information. And like it's been said, bad news travel faster than good news. And those who are really busy at the work of trying to get traction on their pages, on their sites, will not relent. And so we need to be 2 steps ahead of them. I can see Dr. Layinka trying to come in. So in line of this conversation.
Thank you so much once again, Mr. Moderator, Dr. Obiodun. I want to add to what my colleague, Mr. Sunday Oko, just said. Sometimes when I scroll through social media and I saw a post from NCDC, Nigeria Center for Disease Control, I don't just read and walk through, I reshare it. Sometimes maybe National Primary Healthcare Development Agency, they posted something on cervical cancer vaccine or something like that. I reshare it too. So I think the more that we reshare, if almost all of us on this group, if we have a positive story about vaccination and we reshare it, it will get to at least another maybe 100 or 1,000 or thereabouts. So we need to also be more, we should be conscious in sharing positive health information. So if you just read it, it may not really be of benefit to me, probably because I know the content already. I'm also just like one of them sharing the information. But if I reshare with others, then it goes further and further. Just to add to what Mr. Sunday Oko just said. Thank you once again, moderator.
And thank the speaker for bringing that perspective up. People will only make do with the information at their disposal. And the more people share, the more people have access to the right information, the easier will it be to dispel the wrong one. But if the only circulating information is the wrong information, you are left with no choice than to believe. There is a way where it's repeated severally, it starts sounding like the truth. And this is what we should look at. As we begin to tidy up, maybe one or two more questions. Now back to Dr. Lainka. When it comes to advocacy, especially to the unserved, rich population, do you mind to share some experience how effective this has been in ensuring that, or what makes it effective for us to have a success story with respect to how advocacy has helped to improve immunization or vaccination intervention in the country? Are there some experiences you would like to share, whether within the country or other side of the world where you have worked? Dr. Inka, please.
Thank you so much once again, Dr. Biodun. Now, during the peak, at the peak of the COVID-19 pandemic in Nigeria, at that point, people have their own stories to tell. The vaccine hesitancy, everything was there. But the organization I worked for at that time too, we recruited some community health workers. Part of their work was to go into the hard to reach area where they live, talk to people about COVID-19, assist in contact tracing, talk to people about the vaccine, and ensuring that they pick up this vaccine. So, they complemented, they supported the government at the local government level, at the world level. So for vaccination also to get to those who really need them, we all do. If we don't, our relatives, our children, our family members. So to really get to everybody, we should not leave it to the hand of the government alone. That, they've announced it in the radio, in the TV. Just like I said earlier on, we also need to share with our loved ones the good news of the benefits of vaccination. So by the time we are doing this, we'll be able to get more disciples, more people who appreciate, who understand the science and the fact that the vaccines are there to help us. In addition to this, the community health workers, they came from the community. They were recruited from the community, and from those communities, they're able to go back to their own people, not me going to somewhere probably where I cannot speak their language. So that's part of what we do when it comes to ensuring that vaccination gets to the last mile or to the people that are also going to use them. And they design it in a very simple way. I can see a comment by one of my senior colleagues, Dr. Vaz Bolam, that the information has to be shared in a very simple way and in a way that people will understand very well. So those are the things that we did in the past, and they are very helpful. And I believe that more of those things are still being done nowadays. Thank you.
Thank you very much. Prof, I can see with the boss, Dr. Abadola, and I've seen people from Lagos, I've seen people from different parts of the country who are on this call, and this is already showing the spread with respect to how well this webinar has gone. And like Dr. Lainka said earlier on, if all of us can also be committed, at least to start with, in sharing this positive information, we definitely would have achieved something. Actually, I'm not leaving vacuum for those who don't want to catch in and send in whatever they like. Thank you, all the distinguished leaders contributing to the conversation, even through the chat box. And there are a few questions in the chat box I want to quickly bring up. Maybe your thought again, and then Mr. Sunday Oko. There's a question around people being negatively impacted by the COVID vaccine. I know there are a lot of things that went out there during COVID. And is it true? Or what do you have to say about this? You'll come across some of these conversations about the people who, after taking COVID, this will happen to them, and they share a lot of information out there. What will be your thoughts on all of this, and how best can we to get such moving forward? Maybe I start with Mr. Sunday before coming to Prof.
All right, thank you so much. So I would say that, like Dr. Lainka said, most drugs that we take, they have effects, right? Some they may range from mild to moderate to very severe. Vaccines also have effects. However, our government in their own wisdom, right, provided avenues where if you have any reactions to some of these vaccines, right, you could actually report. If you actually go through the reports and check, there were no reports of some like adverse effects. I can say maybe by the last I checked, right? But again, this is not to say that there might be some effects, right? But I don't think they are enough. There is what is called risk benefit ratio, right? So they are not enough to say, oh, because of this, right, let's stop the vaccination, right? So I would still say that some of these things are, like you said, they are just disinformations. People come up with various things, and then with the ease at which we can mark at the same time on our WhatsApp platform, for instance, you can send one message to over 10,000 people on your contact list. It then makes it easier to send out this information. However, when the good news is sent, like you said, like Dr. Biodun said, wrong information really travels faster. When we hear things like, oh, the malaria vaccine has been discovered, right? Nobody forwards such information. Instead, you hear issues around the fact that, the vaccine that someone took, then it's magnetic, is becoming something else, right? So it's always, you are going to have reactions, right? That's my point. It might not, sometimes it might not be there, but the government has already opened its arms saying that, oh, if you feel any effects following a vaccination, please kindly come and report to us. And when you go through this report, you hardly find out such information that leads to severity in terms of death or any of these issues. So, like Dr. Lanika said, these vaccines have been tested, they go through our processes, and we have, so to think that some of the misconceptions associated with vaccines are around the fact that a global funder, someone like, in quote, Bill Gates, wants to reduce the population. We have Nigerians who are there on the same panel for testing some of these vaccines. So I don't think that we want to harm ourselves. So I would like to just end by saying that vaccines remain our greatest hope to defeat future pandemics and even current ones. Yeah. So thank you.
Vaccines truly remains our sure hope for defeating infectious diseases and also possible outbreak or public health emergencies relating to infectious disease that we may come across even as the world keep evolving. Not heard a lot about the microorganisms. They are still busy with their work, and having potent vaccines produced against them is a very effective means of addressing this many. Now, with all the resources put into getting it done, we cannot afford to misuse or to lose the opportunity because of those who are like the leftists, if I want to use the word, those who are just not really accept anything that is coming from certain part of the world. Well, maybe by the time we start producing our own vaccines in Nigeria, I think maybe there's some trust we also coming into, so I won't just think it's about somebody outside there who wants to just wipe us all out of the universe. Vaccines are safe, they are effective, and they're still very much potent. And I like the submission from Mr. Son is saying, if you notice any side effects, it's not unusual. Dr. Lanka mentioned it earlier on. Even if you use other medications, there are some medications that when you use it, if you read the side effects, in the leaflet that comes with it, if you list the side effects, you won't want to use the medication. But you because of that, not use the side effect because no studies have been done, and they can report that maybe this thing will happen in 1 out of 200,000 or 2 out of 100,000. Now, if you have such a situation, would you, because of that, prevent the almost 98,000 people or 990, whatever figure minus, from accessing the efficacy, the opportunity that such intervention brings? So, if one person comes to say, okay, out of all the millions of those COVID vaccine, maybe 2 or 3 persons felt this way, maybe because of the way their body reacted to it differently. We now, for that reason alone, through the intervention and prevent those who could have benefited from it, that may not be the right way. However, because science is dynamic, we are hoping to say whatever you have reported, if anybody has any information, genuine, don't just go on social media. There are reported channels. If you have what we call adverse event following immunization or vaccination, please use them through the primary healthcare facilities close to us. Report. When you go there, document. Maybe we'll start taking the closing shots. We have like 3-4 minutes to wrap up on this meeting. It's a very interesting conversation about vaccination, vaccine hesitancy, and all of that. And so I try to look at the chat box to be sure that no question. Okay, the one about apps, genital warts has been declared to be an epidemic. Do we have vaccines for them? I think the answer is yes. Dr. Lenka, do you want to give a shot at that? Vaccine for herpes and genital wart. What's been the experience?
Okay,
HPV.
thank you once again, Mr. Moderator. Yeah, as we bring it to a close gradually, I would like to just make a reference to the fact that people see road traffic accidents almost every day, or maybe once in a while. That does not stop us from still using cars. That does not stop us from still traveling, driving to a place of work, being in the car. So the fact that there are one or two pockets of reactions to a particular vaccine, that does not say that it doesn't have its lots of positive effects. Now, another thing I would like to mention was the fact that people have accused Bill Gates of trying to reduce the population of the world through vaccination, that is trying to reduce the world, cause impotence, cause infertility. Now, he addressed a TED show in 2010, and what he mentioned was that if people are vaccinated, the population of the world is going to reduce. Now, this is how it works. Even in my immediate family, my maternal grandparents gave birth to almost 11. And by the time I grew up, I knew only 3 of them, my mom and 2 other people. So what something happened along the way, the 7, 8 people died. So now, if the vaccinations are there, people are taking it. You may not even want to give birth to 10 or 8 or 9. When you give birth to 3 or 4, and you are sure that once they are immunized, the health system is there to protect them. Their health is strengthened, and nothing will happen to them. They will die. Some part of the world, if a mother is given, if a woman is giving birth to a child today, the likelihood of the child growing up to age 60, 70 is more than 90%. It is very high. It's almost impossible. It's still happened. If a woman should die out of like 28,000 births, it's like a national disaster to them. So the fact that he said that does not mean what he meant was to use vaccination to reduce the population of the world. Is to strengthen the health system so that people can give birth to the number of children that they desire, not anticipating that something might happen to 1 or 2 of them along the way. Now, someone asked the question, as you said, about vaccine for herpes, vaccine for genital warts. There are several things that we have drugs that can take care of. So for those things, we may not, it doesn't really make sense with all the resources that goes into vaccine production to be producing vaccine for headache. Headache is just like a sign or like a manifestation of something else. So once the drugs are available, we have drugs to take care of some condition. So until a sizable amount of people are suffering from something, from a particular ailment or a particular health condition, that's when it's around going into research, putting in multi-million dollars into research to find a solution like vaccination. But usually there are drugs that could take care of several ailments, several diseases. So these are some of the things that we can use. And I would like to also add, once you have a problem, a challenge, you are not too sure of, going to your healthcare workers, going to the hospital, it's something that we must at least do, help ourselves by doing. So vaccination is there to help us. It's useful, it's helpful. Let's take advantage and let's ensure that we spread the good news. Thank you. Back to you, moderator.
Thank you very much. Thank you very much. That would be a very comfortable point to draw the curtains. So while we are looking forward to address the economic challenges, let's ensure that we don't add salt on injury by allowing preventable infectious disease to worsen the situation we have in our hands. Right? I'd like to say a very big thank you to us, Alberto. Really do good justice. Thanking you and closing mark. I'd like to the representative from Wura is Good Charity Foundation in person of Mr. Bolton Jackson, who will be doing these closing remarks and appreciation to this great audience. Mr. Jackson, the floor is yours, please.
On behalf of the board and management of the Wura is Good Foundation, we extend our heartfelt gratitude to our distinguished guest speaker and everyone that joined us today. Your presence reinforced the power of truth, learning, and collective action. At Wura is Good Foundation, we remain committed to spreading accurate health information, building informed community. Let's continue this conversation beyond today. We can turn this knowledge into amazing things that actually transform our society. Immunization is important, and do not just take it for granted. Everyone in the society needs to hear, everyone needs to do. And thank you once again for joining today's conversation. I hand you over to the moderator. Thank you and stay safe.
Thank you very much, everyone, and hope to come your way again.
Thank you, everyone. Bye.
Hi.
Thank you, everyone. Bye.